Hi, my name is Gracie, and today I will be talking about insomnia. So, insomnia is a sleep disorder in which you have trouble falling asleep or staying asleep. This condition can either be short term or a long term chronic disease. It can also come and go. So, I remember when I was a kid, sleeping late and not sleeping and staying up was the coolest thing. And as I got older, I realized the importance of sleep and how much we actually need it, both for our mental and physical health. Sleeping is something that comes very natural to us. It is part of our daily routine, although many of us do suffer from not being able to sleep and doing this part of our routine. This is called insomnia. And although at times staying up can be fun and enjoying, there are many consequences to not receiving enough sleep. Acute insomnia lasts from one night to a few weeks. Insomnia can also be chronic when it happens at least 3 nights a week for 3 months or more. There are different types of insomnia, such as primary and secondary. Some symptoms of insomnia include trouble sleeping, failure to sleep through the night, waking up earlier than usual, daytime sleepiness, and reduced ability to concentrate. Various studies show worldwide that the prevalence of insomnia is 10% to 30% of the population, some even as high as 50 and 60%, so it is very common. It is common in older adults, females, and people with medical and mental ill issues. So, insomnia does play an effect on mental health. Insomnia can have many negative effects on a person's body and mental health. Sleeping has a bigger factor on our mental state than we like to think. Sleep problems are more likely to affect patients with psychiatric disorders than people in the general population. Sleep problems may increase risk for developing particular mental illnesses as well as a result from such disorders. Treating the sleep disorder may help alleviate symptoms of the mental health problem. Chronic sleep problems affect 50 to 80% of patients in typical psychiatric practices compared to 10 to 18% adults in general US population. So it really does play an effect for people who suffer from mental disorders. They are particularly common with patients with anxiety, depression, bipolar disorder, and attention deficient hyperactivity disorder, which is also known as ADHD. Personally, I have noticed in myself the changes in my attitude during the day when I suffer from lack of sleep. You can see in my work or just my mood towards things. It affects my schoolwork, my work, my relationship with others. When I don't get enough sleep, I become a very grouchy and not looking forward for anything, a very negative person. When going through personal situations, whether it be out of excitement, at times negative events in our lives, sometimes our own emotions lead us not to be able to sleep. I remember, something I will always remember is the night before the first day of school. I would never be able to sleep that night. It was the most exciting night for me. And because of so much excitement that my body had and my mind, I would not be able to sleep. And this could also happen with negative effects on your life. Also, another event that I went through was a breakup. I remember that night I was so sad I couldn't go to sleep. So both very positive and negative effects, events could have an effect on our sleeping. So, some treatment for insomnia. Suffering from this can be very hard on a person. Although there isn't a method to get rid of this completely, there are some methods and things that can help. In order to properly treat and cure your insomnia, you need to become a sleep detective. Emotional issues such as stress, anxiety, depression can cause half of insomnia cases, but your daytime habits, sleep routine, physical health may also play a role. Try to identify all the possible causes for your insomnia. Once you figure out the root cause, you can tailor treatment accordingly. So once you figure it out, what is the reason, whether it's your work schedule, your personal issues, perhaps it's your physical health, maybe something's hurting that isn't allowing you to sleep. Once you figure out what is the root for this issue, it could help you figure out a way to help fix it. So some relaxation techniques can be sleep supplements and medication and changes in a routine. Um, I've realized that working out is something that helps me a lot. I've also tried melatonin gummies. They also help. So there are many methods in helping this problem. It's very important to try new methods and see what works for you because everyone's case is different, and perhaps melatonin gummies or tea isn't going to help a person, and perhaps working out will. So it's very important to figure out what works for you and what is the cause for this. And just remember that sleep is very important in our lives. Um, we don't think about it, and yeah, it can be fun to stay up, but it really does take a toll on our mental and physical health. You feel tired, you feel sad, and it's just very important to get a good sleep. Um, it's very important to know how to get enough sleep and try your best not to get this um, at least chronic insomnia. Insomnia can have many effects on a person's life more than we like to think. So remember to always sleep, maintain a good routine, um, and it'll help you be a better self and have more energy throughout the day. So yeah, that was my speech on insomnia. I hope you guys enjoyed, and if you do suffer from this, just know there are many methods to help fix this problem, and I hope you could all get your sleep on. Thank you.